and have, bring bloggers to their R&D facilities or internally. There are also things like We Go Health, which works with health advocates, so it allows you to build up relationships. It allows you to portray information, show them information, and then they go off and use it.
Yeah, and I think to add to that, it's extremely important how you treat your audience and how you treat your bloggers. You need to treat your constituents, particularly the patients within a healthcare conversation, with the respect and privacy considerations that they deserve. Conversely, you need to treat your bloggers with respect. Recently, Samsung encountered tremendous controversy where they flew in dozens of bloggers from throughout the world for big high-tech events, promising them free travel, room and board, a full complement of services simply for being great. Thanks for blogging about us. Yeah. But the actual intent was to program their itinerary to the minute, provide them boilerplate information that they would then turn and share on their blogs. Nice. So it wasn't a free lunch in any which way, and that engendered a tremendous amount of controversy. Within the healthcare space, it's a little bit more focused. It's obviously not so high profile in this way, but it's equally, if not more, significant. So the respect factor has to go in both ways, to the constituents of the patients as well as the bloggers you're utilizing. And I think the one takeaway here is full and complete transparency.
Absolutely, absolutely. David, do you want to?
Well, so one interesting example, again, on Diabetes Mind along these lines was when Animas, J&J's Animas meter received an FDA warning in February. And this was a case where Amy specifically reached out to the PR folks in Animas and said, we know that this may not be as crystal clear as it seems. We know that there are people who are concerned about these apparent defects with the meter, and invited one of their customer service folks to essentially interview or get into an interview with Amy, which she did and posted on her site, and it allowed the manufacturer to then link to the FDA letter and basically deconstruct the letter in the most appropriate way possible to explain what were the points FDA was making, what were the issues that were being flagged, what was J&J's position in response, and then of course links back to the manufacturer's site. And I think it was an excellent example of both a sincere willingness on the part of a blogger to want to shed light on the complexity of these issues, that just because there's an FDA warning letter doesn't mean that this is a device that everybody needs to now go replace. And of course, it gave the manufacturer a fabulous forum in which to come in, demystify the issue, and then build a relationship not only with the blogger, but again, the community of readers who in many cases are using their device.
Yeah.
I think to dovetail off what David is saying too, there's a shift in the sensibility about what a brand is. That's common within consumer goods as well as healthcare. The traditional notion of the brand is one that's invincible and pure, and the responsibility for marketers ultimately is to protect the reputation of this brand and do so in a way that's as proactive and engaging as possible. But marketers and PR folks have always historically been on the defensive. What's happened in the social media age is you've empowered your constituents, your audiences to speak up. So what that's created is an opportunity for two-way dialogue, and the conventional notion of brands being something that have to be protected to brands which are almost organic living creatures that are thrown out there, evolving with the audiences is important. And that's something I think that healthcare marketers and healthcare brands need to understand, is that our brands are not invincible. Things happen. And when we acknowledge that our brands are living creatures that move through space and that have problems and are imperfect, then we respond in a way which is much more open, which is much more engaging. Rather than being defensive, we're proactive. Rather than hiding something, we're open. And rather than siloing ourselves and simply broadcast blasts of information, we're actually engaging in conversations, and we're willing to take the risk that not all of these conversations will be favorable and on point to what the marketers have established should be the limitations of what that brand is or should be.
I have one example outside the industry in financial services, because people don't expect you to solve everything, but if you're able to at least reach out and talk to people, that means a lot. So as an example of TurboTax has a pretty robust presence on Twitter, et cetera. And they found that 70% of the people who complained on Twitter and then got their issue resolved, then they were more likely to, recommend TurboTax to other people. So I think people are willing to believe that, you're fallible, you're listening, and you're trying your best to fix it. Not everyone goes in with the best of intentions, but most people aren't really looking to flame brands
Yeah.
online.
Yeah.
So let me just touch upon that because, maybe perhaps many of us have been in a situation where if we tweeted something that was critical of a brand, we got a response and we were typically kind of tickled pink because we feel like we have this renewed or new power, right, as a consumer. And it's logical to think that that's something that should be extended into this sphere, on the health sphere. But I did want to provide one anecdote which I think does kind of make for a cautious note here, and that is Mike Hoskins, who's a type 1 diabetic, had posted on Twitter a comment about an insulin pump that he was testing. And he didn't mention the manufacturer. He just mentioned that he was getting weak signals. And with the next day, he had a phone call from a customer service rep from this company, Medtronic. And Medtronic was, and we saw that you posted this tweet, and we wanted to follow up to see if we can be helpful to you with your meter. Now, you would think that Mike in that situation would be fairly elated because here's a company proactively reaching out to him in response to a tweet, but you would be wrong. Now, this isn't to say that Mike speaks for all consumers, but I think, and he blogs about this incidentally, and one of the things that he pointed out was, I didn't mention the manufacturer. It wasn't a flaming sort of I'm angry or upset. It was simply a comment about having been, kind of frustrated with a weak signal. And he ended up feeling like this was a clear case of Big Brother knowing that he had this device and then following up with him, and it was a PR person. And he said, and basically his feeling was, you're doing this either because I'm a blogger or purely for PR reasons. And it totally backfired. And again, you can see this blog about it. It's not to say, again, that you shouldn't be looking at these opportunities to intervene, but I do think that it suggests that it's not, this is a difficult needle to thread, and that there's a point at which consumers need to also be able to say, yes, I'm eager to be engaged with you, but I do want to do it on my terms and not just have you summarily call me because I've happened to make a comment about your device. So, it makes for a challenging situation.
It's a great anecdote. You know that you're never going to bat 1,000 in this space. There's always going to be, the flame, the problem. Any other questions? Yeah, Michelle.
So one of the things that's been quite the phenomenon in terms of blogging is instead of just now being able to express yourself through writing an article, you see sites like Tumblr where people are expressing themselves visually, whether it's with a video or whether it's artwork or what have you. Are you seeing this as a continual trend, and how do you think that's going to affect the way people are continuing to communicate moving forward in the blog space?
One of the earliest examples of that happened a couple of years ago. There was an article about the 7 worst drugs or wasteful drugs,
Right.
and it was Nexium was mentioned. And what AstraZeneca did was have one of their physicians actually do a video on it, and they linked to the, and the FDA stepped in too and had a letter on it too, so they linked to everything. And so I think video is going to become even bigger because that's where people search. My son doesn't know how to do something, the first place he goes to is YouTube. And I think a video response, and it also helps people connect a little bit more with you as a person. So I think that is a big area in the future.
Yeah, I think that's a very, very insightful comment on where things are going overall through digital experiences. And it's particularly poignant in our space for healthcare, where folks are very, very personal. So I think video, multimedia, overcoming this torture of alphanumeric entry within digital, it's a primary obstacle, and it has implications within mobile health as well, biometrics, the quantified self. So there's a shift now away from the keyboard and text into not only multimedia per se, but information being shared. So for example, if I got excited by the point, but for example, imagine a patient who's a blogger, okay, and gets to plug into their mobile health device and actually can share their biometrics and put that contextually within the conversation of how they're utilizing a medical device or a pharmaceutical product. So it elevates the conversation beyond even multimedia and video into I'm sharing potentially the results of my utilization of this. And then that goes out there, and that opens up a host of potential privacy issues on the one hand, but it elevates and quantifies the discussion on the other in ways potentially we can't even imagine. So I think that's a terrific point, how we shouldn't just be concentrating on textual blogging information, but the transformation of digital communications overall and its impact for engagement.